Hello, I'm Nadia Bilchik, joined by my brother, cancer surgeon Dr. Anton Bilchik, for live long and live healthy. And let me say that again, it's live strong, live long and live healthy. Anton, we haven't done this for a couple of weeks. And in the couple of weeks that you and I have spoken, there have been new developments and new research. So let's start off with the new stats that have come out around cancer.
So a recent study has really taken the cancer world by storm, because what it shows is that, particularly in males, from the year 2022 to 2050, cancer rates are going to double, and death rates are going to go up. It's kind of the opposite of what we would think as we embrace new technology. And what is particularly concerning is that these increased cancer rates are proportional also to the socioeconomic environment. So countries that clearly have less resources have even higher cancer rates, or predicted to have even higher cancer rates in the future. So this study is alarming, to say the least.
So, Anton, you and I started this podcast when Princess Kate Middleton, was diagnosed with cancer. And people were astounded that a young woman, healthy seemingly, could have cancer. So when we look at that, and I saw one of the other recent studies, just rises in cancer in general, men, women, what as the medical fraternity do you attribute this to?
It remains an unanswered question. We know that there are clear associations and risk factors. Obesity, for example, is associated with many different cancers. Smoking, lifestyle, diet, processed food, and then there are environmental factors. And there's likely many environmental factors that are cancer causing that we don't even know about. What was really interesting in this recent study, and why cancer rates are predicted to go up in males even more so than females, is because males are not particularly good at screening. Women do better at screening. They pay more attention, whether it be colonoscopies, mammograms. Males tend to be not as attentive to screening, for example, for prostate cancer. The other factor that has been discussed is that males tend to be exposed to more environmental agents that may be cancer causing, and I'm talking about globally. And so there's several factors that have been described. And then there's some very provocative factors as well. I mean, our body is just full of these bacteria, trillions of bacteria called the microbiome. And these bacteria do so much to control our immune system, to prevent heart disease, to prevent cancer. And disrupting those bacteria through unnecessary antibiotics, for example, or too many probiotics, may in itself be causing harm. So there's a lot of very fascinating research that is going on, but to clearly define the reason why cancer is predicted to go up, particularly in underserved and impoverished countries, we still don't know. We still don't have all the answers.
But for people who are joining us, either you're watching us live, in which case, welcome. If you're just joining us, I'm Nadia Bilchik, speaking to my brother, cancer surgeon, Dr. Anton Bilchik. We created this podcast, Live Long, Live Strong, Live Healthy, to talk about the facts and see how we can help you. Obviously, in the last podcast, you've spoken about diet and stress, but it's interesting thing you bring there, probiotics. So what can we take? What should we be taking? And at the end of the day, doesn't it come down to just eating more fruits and vegetables?
Yeah, I mean, that's a really fascinating area, because just think about it. The probiotic business is a multi-billion-dollar business, and It's so well marketed, and at the same time, it's not regulated. So when, for example, you're taking an antibiotic and the bacteria are disrupted, it may make sense to take a probiotic. But if you're eating a regular diet and a healthy diet that's rich in fruit and vegetables, you're already getting your dose of probiotics. So overloading your body with probiotics when you don't need it may cause harm. But at the same time, there is a role for probiotics when perhaps your bacteria are being disrupted by certain diseases as well as antibiotics.
And yogurt, kefir, which is a type of yogurt type drink, also a culture that supposedly has probiotic. Would that be better for you, a more natural form of a probiotic?
Absolutely. I mean, there's so many healthy food products that contain probiotics. So, it's the same concept as people believing if they take lots and lots of multivitamins, they're going to live longer, they're going to live healthier. While there is a role for vitamins, whether it be vitamin D, which many people are deficient in, we tend to believe that by taking more vitamins, we're likely to live longer and be healthier. What people don't realize is that your liver and your kidneys are organs that have to filter whatever you take by mouth. These organs have to filter them. So if you take tons of vitamins or mushrooms or all the other potential foods out there that you think may be enhancing your immune system, that has to be filtered in the liver. You're telling your liver to work harder. You're telling your kidneys to work harder. That's why if you take tons of vitamin C, the color of your urine changes, turns orange, for example. You're stressing your kidneys. You're stressing your liver. So, one of the actual causes of liver failure and that has led to liver transplantation are people taking mushrooms, for example, or some unknown substances that may be toxic to the liver that they're told will increase their life, make them feel better, improve brain function. So you do need to be quite careful as to what additional additive you take with your food.
This is I always learn something each and every time, because you're right, the marketing around certain things is so great.
It's massive.
You feel guilty if you're not taking it. So there's so many things I want to touch on today. A new study has come out that said that regular use of aspirin amongst individuals is supposed to reduce the chances of colorectal cancer. Am I getting that study correct? And is that something we should take into account?
Yes. So, we've known for a long time that taking a baby aspirin reduces the chance of getting colon polyps. And by reducing the chance of getting colon polyps, therefore reduces the chance of getting colon cancer.
And you mean every day, a baby aspirin?
That's what we've known for a while. And these were large studies that were done, so much so that the United States Preventative Task Force, and that's where we get a lot of our guidelines from, in terms of when women should get mammograms, when people should get screened, what age, etc., actually suggested several years ago, they recommended that everyone take a baby aspirin a day to reduce the chance of getting colon cancer. But then they walked that back about 6 years later because of the risk of gastrointestinal bleeding from aspirin. So they walked it back saying, yes, it's something to consider, but do talk to your doctor. Now, the risk of bleeding from your stomach from aspirin is actually extremely.
We just have to take a moment and say that bark is from Billy, and we love Billy, and Billy is a stress reducer. So we get to meet Billy. That's great. So you're saying that bleeding, in fact, is limited, and it's better to take it than not.
Well, so what's different, and this is gets back to the study that just came out. This is a very, very large prospective study looking at predominantly women. And the reason I use the word prospective is it carries a lot more importance in the science world. And these are women that were followed for a long period of time, and they took 2 regular aspirins a week. So they're not baby aspirins, 2 regular aspirins a week. And they looked at 2 groups. One group of women that took 2 regular aspirins a week, one group of women that didn't. And they found that there was a pretty significant reduction in colon cancer in women that took 2 aspirins a week. Now, what was particularly important about this study is that they helped identify which women are likely to benefit more from aspirin in reducing in colon cancer. So women that are high risk, that are overweight, women that are smokers. So really, for the first time, the study is saying, yes, taking 2 aspirin a week reduces the chance of colon cancer, but it reduces the chance even more in certain subsets of women. So it really is important. But again, the caveat to all that is, and the reason it's not routinely recommended is that although the risk is low, there is still a risk of bleeding. In some people, it's a low risk, but there's a risk of bleeding from taking aspirin.
So perhaps limited to twice a week.
Well, that's what the study, this just showed 2 regular aspirin a week. So I think that as long as you're at low risk for stomach bleeding, and as long as your doctor says it's a good idea, this study is quite compelling to support doing that.
And just to qualify everything that you and I talk about, we urge you, if you're listening, please check with your physician first. These are important subjects, and to bring your attention and awareness, but by no means replaces your own doctor telling you what you should be doing. Okay, now let's get on to weight loss drugs. Whether it's Ozempic or Mounjaro, or every day there's tripetazide or another semaglutide that is coming. I see in my feed, certainly every day, you can now have it delivered to your door. What are your thoughts on this huge explosion on weight loss medication? How successful and effective is it? And how overweight do you have to be to take it?
So this is it's become one of the most talked about subjects in research, in science, because we've known about these GLP-1 drugs for quite a while. In fact, it has some meaning to me, having worked in a research lab at Yale University between 1987 and 1990, where we were looking at glucagon and really trying to understand its function. And so GLP is glucagon-like peptide 1. So obviously,
just go into for lay people, that would be like a glucophage, something to deal and
so
keep
it's
your
a,
blood sugar
it's a
regular.
peptide or a hormone that is meant to bind to a receptor and therefore lower glucose levels.
So you're not craving sugar.
Right. That's why it's recommended in people predominantly with type 2 diabetes. Now, what we're seeing is that not only are these drugs enormously effective in weight loss. I think the amount of weight loss surgery has already dropped significantly. At the same time, what also is fascinating about these drugs is that there are studies showing that they reduce the chances of getting cancer. And not only do they reduce the chances of getting cancer by people losing weight, and therefore they're less susceptible to cancer. But these drugs seem to have a direct effect on the immune system, even in people that are not overweight. So we're getting into a really
effect or negative effect.
A positive effect in the immune system that may reduce the chance of getting cancer, even in people that are not overweight. The same, at the same time, these drugs are also showing to reduce the chances of having heart disease, because they have an anti-inflammatory effect. They impact glucose metabolism in the heart. So, this gets into a very exciting space as far as treatment goes. But at the same time, the question now is, who are the best candidates to be taking these drugs? I mean, what we're seeing is, there are clear candidates. I mean, people that are overweight and diabetic, it's a no-brainer. But then what about people that are perhaps higher risk for heart disease or higher risk for cancer? Should these drugs be considered? This by no means am I recommending that. I'm just saying that that's where we're heading. In the world of prevention of heart disease or the prevention of the development of cancer. And I would hate anyone to listen to us and say, well, great, that's a good reason why, I'm going to start taking these drugs, even though I'm not overweight. And what we're seeing is so many people that are not overweight are taking these drugs to lose 5 pounds before a wedding or before an event. And they kind of almost in a way using it recreationally. It just, everyone thinks that it's just so safe, and so it could be used at any time, regardless. But what we're seeing, and I do predominantly, gastrointestinal surgery, is we're seeing the side effects. So because these drugs cause weight loss by slowing down stomach function, people present to our emergency room with severe stomach pain, with gallstones, with pancreatitis. So taking these drugs is no free ride. And I can tell you, some of these people are miserable and have to be hospitalized until the drug really wears off. There's no magical way of just reversing the effect of the drug. So I would, while we're into this very, very exciting time in weight loss with these wonder drugs, I still think they need to be used responsibly.
Yeah, the famous, if it seems too good to be true, then question it. And again, with caution, I would say, and you and I both know people who have struggled, and Oprah spoke about this. She said she'd struggled to lose weight her whole life. And suddenly this has been an absolute lifesaver for her in terms of losing weight. I know she's been one of the most outspoken.
I think that, we since obesity is associated with so many cancers and increases the risk of heart disease. That's the most obvious explanation why these drugs are reducing these people from getting cancer and getting heart disease, just because of significant weight loss. So
I'm just curious, if somebody came to you and said, I have 5-10 pounds to lose, it would be so much easier if I could just try one of these drugs, what would your answer be?
100% no. Not even a question. And unfortunately, these drugs are very easy to get. They're becoming less expensive. You can now get them online. People are traveling to Canada and to the UK, where they can get them cheaper. Because obviously insurance companies are not, are only going to approve these drugs under certain conditions.
And it's interesting because I know with those Ozempic, I have had friends who are diabetic, and sometimes there's a shortage of Ozempic because they don't have access to it because it's so in demand as a weight loss drug. And is there, and I don't know if this is your area of expertise, but the differences between the Mounjaro, the Ozempics, the semaglutides, is that something, are they all under the umbrella of? Because I have people that I know are spending $500-600 a month on it, and I know people that are spending $200 a month. What's the difference?
Yeah, so I think that they all fall under the umbrella of GLP-1 drugs, and there are some subtle differences between them. And there's more drugs that are that are being developed, but I'm certainly not an expert on one versus the other.
Right. So I'm just also curious, like with anything else, you can kind of go to a pop-up clinic down the road and you'll have a physician's assistant or a nurse practitioner administering, or go to a physician. And it seems that all physicians, I have to laugh because there was a time that, for example, if you wanted a Botox treatment, you would have to go to a plastic surgeon or a dermatologist. Well, now you can go to your dentist and the dentist can say fillings, caps, cleanings, and Botox. It's just, it's just becoming prolific that any physician now, whether or not their area of expertise, will do that. It's interesting because I remember going to my doctor for a checkup, and this was last year, so it's already 8 months ago, and she said, we are just overwhelmed in this office by the demand for these drugs and trying to get it approved. And of course, very temptingly, who doesn't want to lose a couple of pounds? I said to her, she said, absolutely not. But she said so much of her office's time and energy is going to trying to get approval. And so it's just, where does one in life ever find the balance, right?
Yeah, absolutely. I mean, it's created a business where some doctors are doing it very responsibly because again, these drugs have side effects, and to just take the drug, get it online, and be monitored in a very haphazard way can have adverse effects. And so the dose of the drug has to be monitored, and there are really expert doctors that know how, who to, which patients are likely to benefit, what doses to use, when to reduce the dose, when to increase the dose. There is so much to it that it absolutely needs to be done under supervision, versus, as you alluded to, what is unfortunately happening. People are opening up these weight loss clinics. It's almost become a concierge business of weight loss. And as long as you can afford to pay for the drug, they'll find some reason to give it to you. And that's the real dark side of these wonder drugs.
Right. So on a very personal level, I know you had to have some knee surgery, right? Are we okay to talk about that? I forgot to ask before. So you had to have some knee surgery. And I know, again, there are so many people who are joining us either live or the recording who've had that kind of knee issue. So I'd love to know your experience as a patient. And again, because this podcast is all about advice and guidance, what advice and guidance you give for other people who are struggling with knee issues?
I being on the other side and being a patient provides you a completely different perspective. And we even did a podcast on all the things that patients and family members should ask and be prepared. And I thought that I was prepared for my knee surgery. And I thought, I even wrote questions down. And I was so enthusiastic to get better quicker that I started physical therapy as soon as possible. But it left me with so many questions. Am I doing too much? Am I doing too little? Is the pain I'm experiencing normal? I started Googling, which is what everyone, and I found so many different opinions that quite frankly, it's been a learning experience for me over the past 3 months, so much so that I can truly understand some of the anxiety or a lot of the anxiety that people have, and also the frustration that doctors have when they think they've answered everything and they think they've provided all the information, but they really haven't. And so being a patient has now, given me a completely different perspective. Not that a knee procedure is cancer or anything major, but it's just the idea of what it's like to be on the other side. And so I have, a huge amount, a much better understanding, and I've been practicing for quite a while, but I have a much better understanding now of being on the other side.
And how are you doing now? I mean, have you got a point where you're pain-free?
Yeah. So the, and this is again being a very, bad patient, having a torn meniscus for many years, and where you have periods of severe pain, and then you're doing okay. I think I was on the schedule for surgery 8 or 9 times over, and I would always find a reason to cancel a few days before because I was feeling fine, because the pain was intermittent. And eventually I did it. And perhaps I started physical therapy too soon, but I then struggled from the physical therapy. And even now, there's a little bit of anxiety as to whether I'm doing too much or whether I need to do more. And I would love my doctor to provide, who's an excellent doctor, to provide a much bigger perspective, or a much better understanding, or a much better understanding of not only what to expect immediately after surgery, but what to expect 2 months or 3 months. We tend to, when you see your doctor for a procedure, the doctor tends to focus on what to expect at the time of surgery and for a couple of weeks after. But but what you really want to know as well is, what about 2 months, 3 months, 6 months, 8 months?
Yeah. And
it's not something that I've thought about, and I get asked this all the time. But now it's again given me a different perspective, because being a patient is very, very different.
First of all, I'm happy you are healing, but I think cautionary tale there, and this is to all of us, is after any kind of medical procedure, do we get going? How compliant are we really? Do we listen? Do we fully understand the ramifications? So, of course, conversation to be continued. And I wanted to end today just on a quote I heard. It's an Abraham Lincoln quote. And so much of what we've spoken about over the course of our conversations has been the power and impact that stress has on the body. And in that, and as you all know, I'm a global speaker and professional development consultant and communications consultant. So I'm always looking for great quotes. And this came across as a really good quote. And it was Abraham Lincoln saying, one of the best antidotes to stress is the ability to choose one thought over another.
Love that.
I thought you would appreciate that, because right now in all of our lives, are we spiraling down with our thinking? And particularly because it's a time where American politics is so divisive. There's this hideous war in the Middle East. There's a war ongoing in Ukraine. So how much do we allow the external to impact us? And I leave you with this thought today, and are we being proactive influencers, or are we being reactive responders? So that's my last thoughts for you today. My website is nadiaspeaks.com. Again, advice and guidance from my very brilliant brother, Dr. Anton Bilchik, is advice and guidance, but please check with your medical professional. This is no substitute for that. And final thoughts for this week?
Just been so many interesting research studies that encompass what we've been talking about for over the last few months, which I just find absolutely fascinating. I'm sure that that there's a lot more coming in the next few months. I think the stress factor is, people have to think, when they're getting stressed, when they're getting anxious, that it's affecting their immune system, and it's affecting their bacteria in the body, and it's predisposing them to illness. They've got to think of stress not just as, they really, and this applies to all of us, because as you said, we all have stress, and there's so many reasons to be stressed, but you know, now there's real science behind what stress does in terms of heart disease, cancer, and everything else. And I think if you think about that every time you're stressed, that you're actually doing harm to yourself, to your body. It's not just the way you're feeling in your brain, but you're actually causing some damage inside. That may make you pause.
Let us leave it on that. And when we speak in September, I really want to talk about a wine study that's come out. I had to laugh because the way David Muir on ABC spoke about it, he said, people who drink wine are more likely to die. And I was like, well, that's very interesting. This is the particular way he phrased it, because I felt like saying, and people who don't drink wine are also likely to die.
Well, guess what? The Mediterranean diet actually includes a glass of red wine.
Oh, good to know that. Anyway, so let's discuss alcohol, continue the weight loss drug conversation. And please, for those of you who are joining us live or recorded, send us your topics.
And a tequila day keeps the doctor away.
I love that. A tequila away. Funny you should say that. I remember being in Mexico and having a sore throat, and I went to the concierge and I said, what can I do? And he handed me a small bottle of tequila.
Yeah.
So who knows? Have a great rest of the month. Look forward to our September conversation. And please send us your topics. Today's conversation came out of a response from you telling me how much you've enjoyed listening to the insights of Dr. Anton Bilchik. Anton, thank you, because I know it's very precious time. And as we always end by saying, bye, Mom. Hi, Mom.
And see you soon, Mom.
And see you soon, Mom.